To be able to understand a concept clearly, you need to know exactly what it is. Schizophrenia is a mental disorder that doesn't just affect the way a person thinks, it also has an effect on the way they feel and behave. Schizophrenia allows for a complete disconnect with the world. Although there isn't a single known cause, those related to schizophrenics are more susceptible to inheriting it. Parents have a 10% chance of passing it on to their child. Monozygotic twins have 40% to 65% chance, and general population is 1%. Doctors have the ability to diagnose children as young as 6 years old, but it can be confused with Asperger's and autism. For that reason, doctors often wait to test when they are between 16 and 30 years old. There are many diverse types of schizophrenia: paranoid, disorganized, catatonic, undifferentiated, and residual. Each schizophrenic shows different signs, but they all fall into two or more of the six symptoms: delusions, hallucinations, disorganized speech, disorganized behavior, negative symptoms, and total withdrawal. Delusions are when the patient thinks someone or something is out to get them. They can also believe things such as billboards or celebrities are talking to them. They may also have a tendency to believe they are celestial beings such as Jesus Christ. One most common effect of delusion is thinking that the government controls everything they do. Hallucinations can either be auditory or visual. This symptom can be shown anywhere, but is more vulgar and abusive when they are alone. Disorganized speech is demonstrated when they lose their train of thought, repeat previous phrases, use made-up words, or when they rhyme random words together. Disorganized behaviors are seen when they struggle to do day-to-day things and lack in impulse control. So-called negative symptoms include lack in emotion, enthusiasm, and interest. Total withdrawal is most common in teenager schizophrenics. They seclude themselves from peers and life in general. This example is a video that shows you what it's like to experience the life of a schizophrenic. It is quite disturbing to watch and experience, but can you catch all the symptoms demonstrated? This next example is quite personal. I have a grandpa who is a paranoid schizophrenic, and this is his story. My grandpa was diagnosed as a schizophrenic at around age 21, but was pronounced as bipolar at an earlier age. He showed symptoms of delusions, but showed primarily auditory hallucination. He believed that he was sent here to keep the demons away. My grandpa's perimeter around his house was wrapped in red wire, and he had copper wire and magnets put all around or installed in the electrical equipment in his house to keep the demons away. He also took copper tubing and made a staff, a crown, and armbands to help protect him from and to help him fight off the demons. Whenever he took out his Bible, you knew that Grandpa was sick again. Although my grandpa is sick, I've never felt scared or unsafe to be around him. This is a picture of my grandpa. He is in the center, along with my dad on the bottom left, his sister, his brother, and his mom. Lauren has also had a similar experience. Her great-uncle Larry was diagnosed with schizophrenia in his early 20s. He is in his 70s now, so he has fought this disease for over 50 years. During that time, his main struggle has been to keep his medication at therapeutic levels. For years, he would yo-yo on and off his medications. He would get to a therapeutic level and think he didn't need his medications, nor like how it made him feel. He would decide to try to go without medication, which would always end the same. It would take sometimes over a year of him suffering on his own with symptoms before he'd go back in to restart treatment. Because of this cycle, he divorced and caused strained relations with his children. He now lives in Gilbert, Arizona, and will not move. He loves his doctors there, and they had a program that made it near impossible for him to stop his medications. This is a picture of Larry's family. From left to right, there's Gail, Sean, Elaine, Glenn, Marvin, and Larry. There are a great amount of so-called treatments, but it is extremely rare for them to last forever. My grandpa was on many of these, but the ones that worked the best were lithium and Haldol. If not controlled, it acts like any other disease and takes over your life. Although it is hard to treat, it is far from impossible. Some interesting facts. Schizophrenia affects men and women equally. Mary Todd Lincoln suffered from schizophrenia. If you don't know who that is, she is the First Lady to Abraham Lincoln. There are quite a few common myths. It is said to be a rare disease, however, it is not. 1 in 100 people are believed to be schizophrenic. This has been a fascinating topic to learn about. It was amazing to get to know more about the monster known as schizophrenia.